So I would like to introduce Suzette. Suzette is one of our patients that's joining us on this aesthetic journey. Now, it's hard to believe, but Suzette is actually 58 years old. She's got phenomenal skin quality, but we're starting to see the signs of aging in the face. A little bit of beautification. She's a gorgeous woman, and we're just going to enhance what we have already.
So as you can see, my skin is starting to sag here. So obviously when I do this, I look like old. So I need a lift, some sort of a lift, yeah. And then obviously for me, my also big thing is with age, this starts to sag. So it looks like my eyes is getting smaller.
Yes.
So if possible, something like a little bit of a lift here. And then I've got dark circles. I don't know if you can do anything about that, but for me, that's also a major thing. And then, of course, if you frown, there's lots of lines with Botox or whatever.
Okay, so we've identified Suzette's needs. Let's take a look at what is causing what she is seeing. So, Suzette is also a very active and healthy patient. She does a lot of sport, and therefore, she has quite a low body fat percentage, and that's one of the key factors. So let's start with a facial assessment. I want to start with skin. If we look at her skin, it's almost flawless, but we are starting to see the signs of collagen loss. So if we take a look, we assess sagging in the skin. And with Suzette, we can see there's quite a lot. And this is what she referred to. When she stands in the mirror in the morning, if only I can look like that. So a lot of sagging in the skin. And then we also see some laxity, quite a lot of laxity. And this is directly due to the loss of elastin and collagen. We're also starting to see volume loss. Now, as we age, there's changes to the bony skull. The skull starts changing shape. If we take a look, we are starting to lose definition on the zygoma or the cheekbone. So we're also starting to see flattening in the maxilla or the cheek area here, and that is creating volume loss and sagging in the lower part of the eyelid. This is what's creating that dark shadow that we have there. As we also know, the shape of the orbit, the eye socket, is starting to change from round to more oval, and as we get older, even square. And this is creating the look of a sunken eye. The volume loss that we have and the lack of support from the underlying tissue is contributing to the sagging, creating the nasolabial line, the sag and droop in the corner of the mouth, and the marionette line. So if we take a look at her from an angle, we can see flatness in this area, volume loss here. We're starting to see a rotation of the chin upwards, creating an unfortunate or an unflattering profile. So our treatment protocol is going to be a combination approach to treating the quality of the skin. In other words, sagging, laxity, and volume loss of the skin. We're going to use a poly-L-lactic acid biostimulator from the Galderma range by the name of Sculptra to treat all of these conditions. It's also going to help a little bit with hydration, and as she already has beautiful skin quality and luminosity, it will aid that as well. With the Sculptra, we are also going to create a slight natural volumization, especially in the temple area, in front of the ear, and in the cheek area, creating a softer, more flattering and feminized look. As we carry on, we will address the volume loss and bone loss in the mid-face by using a filler, a tissue filler from the Galderma range. We're going to treat the piriform fossa, this area here, next to the nose, creating more volume, and that will create a softer line. Rotating the chin downwards with the filler will also strengthen the jawline. And then ultimately, we're going to do some window dressing by addressing the tear trough as well as the lips. So follow us over the next couple of weeks and we'll take a look at how we progress with this treatment. So I most often start with treating quality of the skin with a collagen biostimulator, polyl-lactic acid, and the product that I use is Sculptra, the original polyl-lactic acid. So as we can address more than one condition at one go with this polyl-lactic acid, we're going to address lifting, and therefore we're going to inject in the temple area. I always see it as the foundation for lift. We're going to treat into the hairline. It's also going to give us a natural volumization. For lift, we always treat on the side in front of the ear, so we can see there, and just look at how much that lifts both the neck and the jawline. It also pulls back, it creates an anchor. And then I'm also going to address volume loss and sagging of the skin in the mid-face. And therefore, we're going to treat with Sculptra like that, pulling all of this back, creating a natural volumized and strengthened look in the skin. So I always start treating in the temple area because it gives us wonderful support for the rest of the face. And it also allows us to get quite a lot of lifting towards the back, so that instant facelift that we always do in front of the mirror in the mornings, this is what gives you that look. So the second part of the treatment is treating in front of the ear, again creating a lifting effect towards the back, strengthening the jawline, lifting and supporting the middle of the face, and it lifts that nasolabial line and it gives great support to the tissues in the front. Suzette, how would you rate the discomfort on a scale of 1 to 10?
So 10 is what?
10 is the worst.
Honestly, I would say 1. The only thing I can feel is the aircon on my skin, and that's it. It's very good.
So now I'm focusing on giving a little bit of volume in the middle of the face, just for a little bit of support. And that is our treatment with Sculptra on this side done. So this is directly after treating half the face with 1 vial of Sculptra. And what I want to illustrate with this is how important natural volumization of the face is. So if we can take a look, we have treated in the temple area, giving us lift as well as volume, opening up the eye. We've treated in front of the ear, lifting and strengthening the jawline, as well as pulling back on the nasolabial line, and we can see the difference there already. I've also put some Sculptra in the mid-face, and this is giving us volumization. And if we take a look versus there, we can see the difference in the luminosity of the skin and definitely in the appearance of a tear trough line. What we need to understand is that this treatment has put a lot of water into the skin, but this is going to absorb over the next 48 hours, and the patient will immediately return to that look until the collagen starts forming in about 2 weeks, and that will continue and get better over the next 3 to 6 months.